Well, thank you so much for giving me the opportunity to tell something about the project in Sierra Leone. I'm sorry that I'm standing here alone. We loved to come together with one of our Sierra Leonean colleagues, but because of the Ebola situation, it's not possible. So I apologize for that. It's just me. To continue on what we heard this morning, we've seen this picture yesterday and today that the poorest part is not receiving the amount of surgery that is needed. There's the next slide, please. There's a big surgical need, and that's the same for Sierra Leone. If you look on the number of medical people that is actually operating in the district hospital, this is a survey from 2008. There are about 40 people operating in Sierra Leone, and 3/4 of them are in the capital. So there's very few surgical resources. If we look at the next slide, we see that there is a big need. A survey in 2012 done by Groen shows that about 1/3 of the population reports to have a surgical condition. About 1/3 of the households report that there has been at least one family member dying, and from those 1/3, about 1/3 of those deaths could maybe have been benefited from surgical care, concluding that there is a large unmet need in surgery in Sierra Leone. As we heard this morning, in East Africa, there has been a task shifting program in surgery. Task shifting means the delegation from activities to less specialized personnel. Most known examples are, of course, the anesthetic nurses that is well known all around the world, but also the ophthalmic nurses that are doing the cataract operations. Surgical task shifting focus on surgical tasks that could be shifted from specialist to non-specialist and from doctors to non-doctors, also called non-physician clinicians. Great experience from East Africa over the last 30, 40 years shows that in Malawi, about 90% of the cesarean sections are done by non-physician clinicians, but also Tanzania, 84%, and Mozambique, 92%. And one of the biggest advantages of the non-physician clinicians is that they stay in their area. The experience from East Africa shows this is a randomized, non-randomized control studies that have been compared in a meta-analysis published in BMG 2011. Shows that there are no significant differences in maternal deaths and perinatal deaths comparing the doctors with the non-physician clinicians. In 2011, the organization Kappa Care started with a surgical training program using the idea from East Africa to implement it in Sierra Leone. By training the non-physician clinicians, which are called community health officers in Sierra Leone, to do basic life-saving surgery and obstetrics. Then it's not just implementing the concept, but also doing it in strong cooperation with the Ministry of Health and Sanitation and other NGO hospitals. Yes, next slide. The training program is a 2-year program. So after the community health officer training, the students need to have a couple of years of experience in the field, and then they can be entered into the training program. The selection process is done by the NGO Kappa Care together with the Ministry of Health. And after a 2-year training program, with basic training and practical training, there's an exam done by the chief surgeon and the chief obstetrician of the country. After the 2 years, there is an assessment period in the governmental hospitals called as a housemanship. The curriculum that we use is the books written by the WHO, which are very useful. It's consisting of theoretical training, like classroom sessions. It's skills training. Ultrasound is part of the course, but also practical obstetric training. And of course, a lot of practical training, on-the-job training, operating together with the supervisors, and also gaining more independence. This is the map of Sierra Leone, and here you see all the partner hospitals. In the middle you see the number one is Msanga Hospital. That's where the training starts, the basic surgical training, and after a period of 6 to 8 months, the students will move on to other training hospitals and come back before the examination, before they move on with the housemanships. When they are assessed by the chief surgeon and the chief obstetrician during the exam, there will be a check on how many operations they've done, which kind of operations. There will be a written exam and an oral examination. After this period will be the housemanships. The reason for the housemanship is to assess the students before they move into the government, before they are absorbed in the governmental system, and it will be final preparation. In 2011, we started with 2 students, and more or less every half year, we took in a couple of students, and the number of students is now over 25. And you see that also the first students have started with their housemanship. Most of them are community health officers. We had 1 medical doctor that was accepted, most males and 5 females. Here you see an overview of the intake, 31 students. From those 31, 16 are still in training, 8 are in housemanship, and 2 are started to work in the district hospitals in Sierra Leone. And 4 students dropped out of the program, and the medical doctor started specialization in Ghana. If you look at the number of operations they attended during this period, it's almost 15,000. This is by July 2014. Most of them as assistant or as observer, and gradually they're moving more in independence, especially during the housemanship. Top 10 procedures, 50% is already top 3 by inguinal hernias, cesarean sections, and laparotomies. This is looks like the similar picture with the number of students. Here you see the number of operations which has risen from 200 in the first half year till over 3,500 in the last half year. This is the figures until the Ebola crisis started. In May 2014, the first Ebola cases were identified in Sierra Leone. And in the meantime, this is the data from yesterday, is that over 5,300 cases have been identified in Sierra Leone and almost 1,500 deaths. And that shows Sierra Leone is one of the most affected countries together with Liberia. And about 10% of all the affected people are healthcare workers. Most nurses, but in Sierra Leone alone, 5 doctors have died. If you look at the numbers of the Ebola cases, you need to have in the back of your mind that this is probably an under-registration, especially if you know the healthcare system. Not all the cases will be counted, and there's a huge indirect mortality. Hospitals that are closed, but healthcare workers that are not coming to work, which means that a lot of people will not seeking for care and will not get the treatment that they need. And the Ebola has a huge impact on the healthcare system in general, and also after the Ebola crisis, there needs to be a focus on the Sierra Leone healthcare systems as well. Next slide. This is, shows the same picture as before, but now with the included the last 3 months. And the purple line shows the number of Ebola cases. And there you see that while the number of Ebola is going up, the number of surgeries is going down. Teaching facilities are closed. And most sad of all is that one of our students have died as a direct cause of the Ebola. Yeah, you can go to the next slide. So to conclude, is that the program shows that it is possible to set up a training program to increase surgical capacity. That it is important to do this in cooperation with the Ministry of Health and other hospitals, and we're happy to do it in that we have close contact and supervision of the students. There will be still challenges with setting up a quality control and a legal framework, and at the moment our biggest challenge is the Ebola situation. For the continuation of the training, we will still need more specialists that will take part of the short training courses. So if you're interested, please contact me. Thank you.